All right, well, we'll go ahead and get started. Just some housekeeping items. If you take a look at your screen on the GoToWebinar launcher, you should be able to ask questions and post questions. So feel free to do that at any time. I will try to keep the introduction short. I can't stand being on webinars that drag that out too long, so I won't put you through that, and we'll get right into the content. I know that everyone's time is really important. So if you send me questions, we'll try to get to that point as quickly as possible, and then we'll try to answer your questions. If we do run out of time, we'll try to keep this webinar to an hour, but if we do run out of time, just know that I will be sending a response email with a recording of this webinar, and we'll also be taking questions there as well. And our guest today you'll have their contact information should you want to send them a direct message. So the title of today's webinar, Responding to a Pandemic, a Conversation with Employment Law and Benefits Counsel Regarding the Novel Coronavirus. So the presenters today, I myself am with Sky Insurance Tech. My name is Trent Hyatt. I serve as the Chief Marketing Officer at Sky Insurance Tech. We handle ACA reporting and compliance reporting. We work very closely with Tabitha George there at the benefits practice. So we'll touch on some ACA compliance things in the latter part of the presentation today. Should you want to get a hold of me, my email is right here on your screen, as well as my phone number. With us today, we also have Michelle Anderson. She's a partner at Fisher & Phillips. We've used their firm for years, and I can't say enough good things about them. Her contact information is on the screen as well. And then we also, last but not least, have Tabitha George. She's a partner with the benefits practice. I worked hand in hand with Tabitha here for maybe, what, Tabitha, about 5 years now.
Yeah, great,
and to say that she is good at her job is an understatement. Her contact information is here, and we will just go ahead and jump into it. Michelle, Tabby, I'm not sure if who wants to handle this next slide, but just an introduction into what's new today.
Sure, and this is Tabby. Really, I think we all probably know what's new today. I created these slides last week thinking that, we might have updates day by day, which we do, but I think right now we just know that we're hitting a critical point, that we have not hit a peak yet, that hospitals are strained and could become no longer able to take new patients, whether it's for COVID-19 or another issue. So we know that today we're not in a good place. I would say. I don't know, Michelle, if you want to add anything.
Sure. Well, nice to be with everyone this afternoon. We know that this information is super timely and important to your businesses and your clients. So obviously things are changing rapidly. We know that there are more places that are issuing stay home or shelter in place types of orders. Houston just came down with one a matter of hours ago, and so that continues to change sort of the impact on businesses, essential, non-essential, and then the employees. So we're getting lots of questions about that. And then, of course, people who are now coming back that we're doing the testing, people who are coming back as testing positive, and then the people that they have exposed. So, we just continue to see, every day states are adjusting state by state when it comes to unemployment, insurance, paid leave. We know that we've got stuff up at the Hill in Washington, D.C. that still is stimulus package, and so it seems like it's hour by hour. So what's new? If you ask me in 20 minutes, what's new? We might have a different answer, but so anyway.
Yes.
So one thing that is fairly new is this Families First Coronavirus Response Act. Now, correct me if I'm wrong, but this is some legislation that was signed literally last week, the 18th, something like that.
Right.
Right, and this affects employers. So I know that we have this on our minds. We're trying to figure out, how does FMLA apply during this period of time? Individuals are staying home with family members who think that they may be exposed to someone or something, or maybe they tested positive. There are individuals who are higher risk. They're staying home, not wanting, to expose themselves to the workplace. A lot of us are working remote. We understand that, but it's a time of new information. Things are moving very quickly, and both of you are very familiar with the Department of Labor and obviously this new legislation. So do we want to talk a little bit, do a little intro as far as the Families First Coronavirus Response Act and what that means for employers?
Sure. So this new act, exactly as Trent said, was signed into law by President Trump on Wednesday of last week. It applies to employers with fewer than 500 employees. So if you have more than 500 employees, that doesn't mean that the FMLA doesn't apply to you, but it does mean essentially that you're not going to be eligible for reimbursement for paid sick leave in the same way that employers with fewer than 500 employees will be. And you're also not held to the same requirements that come in under these new two provisions. I like to think of them. One is paid sick leave for 2 weeks that essentially correlates with, either a quarantine or isolation or being sick or being home with a child because of the coronavirus. So all of it should be related to the coronavirus, and it will be a requirement for employees who cannot telework. So if they can telework, you don't have to give this leave. Obviously, you would be paying them in that case. But for employers who are subject to these new two provisions, there's that 2-week paid sick leave, and then there's the 10-week extension of the leave, but that is only for parents who have to stay home to take care of their child because the child who's under 18 has experienced a school closing or a daycare closing, or their regular caregiver cannot take care of them because of the coronavirus. Something that came out this past Friday, so 2 days after the law was enacted, there was preliminary guidance issued by the agencies, the IRS, the Treasury, and the DOL, and we're expecting more probably tomorrow. But what this preliminary guidance said was that the way they're going to reimburse employers for the amounts they pay out in this required sick leave is they're going to have employers keep those amounts out of the withholding from employees that they've kept, and that they pay quarterly for taxes. And they are also going to be able to take those amounts out of FICA. So to the extent that you're a business and you have a savings account where you keep employee withholdings for employment taxes and your FICA payments that you give to the IRS quarterly, you're going to be able to take the amount you paid for sick leave or this new parental leave out of that amount on a quarterly basis for leave that you gave in that quarter, which means that on Friday, the Treasury came out and said, you can start giving this leave today. So you could have started this past Friday giving paid leave, and we will reimburse it, which means that you could give 9 days out of the 10 required days of paid sick leave in March and take that directly out of the payroll and employee withholdings you would have submitted to the IRS for this first quarter, which is interesting. I mean, I thought that guidance helped make it perhaps a little more doable for employers. Michelle, do you want to kind of take over here and continue explaining the new law?
Sure. So like Tabby said, the guidance came out on Friday where businesses could start offering that paid leave and getting the reimbursement set up for that. But it's important to note that you're not obligated to do that paid leave until the effective date of April 2nd. And so I know that I've had a lot of businesses who are really in the very desperate period of time where they really cannot afford to do the paid leave. They're, fall outside of an essential business, so they're relatively shut down. They're a business that cannot have people work from home, and so we're still having to walk this line with a lot of businesses about doing layoffs or even reductions in pay an hour. you know, people who are sizable being subject to the WARN Act. So, you know, while this is one potential opportunity to keep people working, and it was designed for that reason, we also know there are a lot of businesses that just are not going to be able to front the pay to these folks to then get reimbursed on the quarterly taxes, you know, a few months from now. So, you know, with that, I think we can probably move to the next slide and delve a little bit more into the details of the leave itself.
And Michelle, I was just going to mention for small employers, so employers with 50 or fewer employees, number one, the FMLA just generally now applies to you through the end of the year. So you should be aware of that and maybe brush up on your requirements for people who are still employed under the FMLA. Also, the guidance that came out on Friday, the guidance that came out on Friday suggests that employers with 50 or fewer employees are not going to have any kind of exemption from the 2-week paid leave law, which we're going to be talking about at first and on the slide. But they may be able to qualify for an exemption for the parental leave, so that 10 weeks of extra paid leave for parents who are home taking care of children as a result of the coronavirus. So we're waiting for more clarification on that. And what the agencies have promised is that it's going to be a very easy standard to understand and follow. So we will see if that proves out.
Right, exactly. Because at this point, we don't know, we don't have a process in place for people to get exemptions. I think that's one of the things we're expecting to come in the next couple of days from the DOL. Tabby, is that our understanding?
That's my understanding, especially because the requirements go into effect April 2nd. And so, yeah, and I think we're expecting from the DOL a notice that you would place tomorrow. And so I'm guessing we're going to get more guidance at that point, but we don't know. I was surprised at how quickly we got the preliminary guidance, and I was glad to have it. So on this next slide, you know, who qualifies for paid sick leave, you all can read, you can read these different scenarios of when an employee would qualify for this paid sick leave, which for employers with under 500 employees, obviously that now if they're still employed, you will have an obligation starting April 2nd to give this leave. You can look at these. The important things to note are if the person asks for leave under the first 3 scenarios, you will be giving them paid leave at 100% of their normal rate. If they ask for leave under the last 3, 4 through 6 scenarios, leave will be given at 2/3 of their regular rate. And on the next slide, we have the limits for that leave. I know a lot of people have gotten, I know I send out alerts to my clients. A lot of people know these facts, but what we're hoping to do on this webinar is get into kind of the gray areas. So one thing Michelle and I have been, bouncing between each other is, what counts as a quarantine or isolation order by a federal, state, or local authority, especially because the United States tends to be going toward a stay-at-home order. Is that isolation or quarantine? So I've been thinking that it is. Michelle, do you want to weigh in?
Unless and until we are told something differently in guidance that may come out in the next couple of days, I've been taking the position that these state and local stay-at-home, shelter-in-place type orders that apply to non-essential businesses would fall within number 1, because I don't know how else to interpret it at this point. So again, unless there's some different guidance that comes out in the next couple of days, we're on the same page of looking at it in that way.
Right.
Just a heads up, and just to let everyone know who's listening to me, I am getting your questions. We have received a flurry of questions. So as we cover these different bullet points, we're getting 2 or 3 questions on a lot of those. So we definitely want to make sure that we get to the end. I mean, some of the questions are being answered as we go through the details. But I just want to make sure that we leave time to get to these, because people have very specific questions as they pertain to their circumstances.
And,
So
sorry.
Oh,
Oh,
sorry.
no.
I
I think that's actually the best use of our time is to get to the questions. Michelle, go ahead.
Yeah, I'd say I bet you one that's pressing right now is about whether you know if you are an essential or non-essential business. So the first thing that I've been telling people to do is to look at the order that is issued by whichever governmental agency. So if it's a local order or if it's a state order, look at that order and see what it determines as essential businesses. Some places are just simply deferring to Homeland Security's memo that was published on the 19th of March, which outlines basically certain industries and businesses that are attenuated to those industries as essential services. And there are a lot of, infrastructure, utilities, healthcare, groceries, pharmacies, restaurants that are providing, delivery, takeout. So, and a lot of the businesses that are sort of appended to them. So if your order is simply deferring to Homeland Security, that memo goes into a much deeper dive. So I know that's one question that I'm getting a lot of. Another thing is we are maintaining, Fisher Phillips has completely transformed its website to be a COVID-19 resource center. And we now have an entire task group that's dedicated itself just to these shelter-in-place, stay-at-home orders and reporting on those. And there's a whole part on our webpage for that, just like I am part of the task force that is doing all the 50 state compliance work. So that is also a quick resource for you.
That's great. Yeah, Fisher Phillips always has great resources, and that's where I started my practice and was there for a long time with Michelle. And that's a really great idea, Michelle. Go to that website. Trent, along the kind of what we were saying. Oh, go ahead.
I was going to say, I have a very specific question as we talked about who qualifies for paid sick leave. On number 5 on this slide, it says caring for a child pursuant to the provisions for paid parental leave above. On this next slide, leave for reasons 4 through 6 compensate 2/3 of regular rate. One of the questions that's come in a couple of times is, what if this is a husband and a wife? Both of them stay at home. Do they both collect 2/3 pay if the child's home?
Michelle and I were just
talking.
Yeah.
So this is I would say this is an area where we would probably, absent any other guidance that comes out to the contrary, if typical traditional FMLA comes into play, when you have leave for the birth or adoption of a child and both employees work for the same employer, there can be a splitting of the 12 weeks, not both each getting 12 weeks. So I would say that if these people both work for the same employer, again, absent different guidance, they're not both going to get paid by the same employer to sit home for the same reason. But if they work for different employers, I don't think that has even been addressed at this point. But
right.
my person, go ahead, Tabby.
Oh, well, I think we're waiting on guidance, but it is the case when you look at the law that, you're supposed to be staying home because of COVID-19 and a school closure because you need to take care of the child. So if you have a spouse that's also staying home and can take care of the child such that you could go to work, then, I don't think this leave applies. That's my read on it. Michelle, do you have a different read?
No, that is my read on it too. And certainly, if if we have people who are dividing caregiving responsibilities, maybe we have, one parent taking, so many weeks, and then they're able to go back to their job. And then now our employee is going to stay home and take care, for the next several weeks. But I really don't think that the law envisioned both parents staying home for that same reason. But, you know, again, we'll see if there's any guidance on that.
Can we talk about, and thank you first, but can we also talk about if there are any specific exclusions for employers who have less than 50 employees, like for those employers that are not applicable large employers?
Sure. Yeah. So what the law said when it was passed was that the Department of Labor could come out with exceptions for employers with fewer than 50 employees. And what it appears that they're going to do based on the guidance Friday is they're going to create kind of simple, easy to follow standards or a standard for employers with fewer than 50 employees if giving the 10 weeks of paid parental leave would put the business viability in jeopardy, then you can exempt yourself as a small employer from that requirement. But it looks from the preliminary guidance like the 2 weeks of paid sick leave will not have an exception or an exemption for small employers. Of course, you know, just like Michelle was saying, we're waiting for guidance this week. But the
right, yeah.
clear.
Yeah.
Mm-hmm.
So we'll have to see. And I really do hope that it's easy and simple to understand, because those of you who live with the Family Medical Leave Act, you know that it is not simple and easy to understand and administer. So I really do hope that that's what happens.
Yeah, here's another question that's coming in, and it's regarding communications and remote capabilities from these employers. So if you have an employer that's providing work-at-home capabilities, can an employee still claim the 12-week paid emergency FMLA if they don't want to work remote? In other words, they have a child at home. Okay.
I don't think so. I don't. If they can work, I mean, again.
The paid sick leave law has, so when it says the employees who could, when it talks about the employees who could qualify, it says, you know, employees who are on a leave because they can't work and they cannot telework, you know, maybe qualify for this leave if. So that's actually part of the law, at least under the 2 weeks of paid sick leave. Now, you know, whether a parent can telework while watching a child, Trent and I were talking about it this morning. I think, Trent, you have a newborn and a 2-year-old, you know, possibly in your lap right now. I have a 3-year-old and a 5-year-old, so that becomes another question. But definitely that's part of the law, especially for the 2 weeks of paid leave, that if you set up telework, you don't have to give the leave.
And I believe that's also even for the expanded FMLA too, if they can telework. Yes. I believe that if they can telework, then when you think about the reason that this law was passed, it was passed because we have entire industries of people who literally lost their jobs in the blink of an eye because they have jobs that do not translate into remote work, and they have jobs in industries where there were where they were either like service industry types of jobs, and were considered in part, in some way, shape, or form, non-essential. So this is really designed at those people that, but for this paid leave, they're going to be out on the unemployment system. And this is a way to help defray the strain on the unemployment system.
Although the sad thing about it, I read a Washington Post
article. But it hasn't done that yet. But it hasn't done that.
It has not done that. And also, I think 84% of Americans work for companies with more than 500 employees. So this is really, you know, just going to be the tip of the iceberg to the extent that it helps. But I think for small employers, especially if you have the cash flow, you have the option of offering it and then being reimbursed. And, you know, if you can offer it in this quarter and be quickly reimbursed, it's a, you know, it might be something that could help you and your employees, hopefully.
Tabby, do we know if these leave wages are taxable?
So based on the preliminary guidance, there's the preliminary guidance has bullet point takeaways, and one of the takeaways was that the payments would not be subject to FICA. But, you know, I think that they'll be subject to, you know, employee withholdings. But I'm waiting for more guidance because I've heard that from secondary sources. I saw it in the preliminary guidance as one sentence, but I'd like to see it, in kind of more concrete terms in the subsequent guidance, simply because you're going to be getting reimbursed from the FICA that you're submitting anyhow. And I just want to make sure the government doesn't think, part of your reimbursement is going to be the FICA you would have paid on the sick leave. I don't believe that's going to be the case. I'm just waiting for further guidance. Michelle, did you have a take on that?
No, I would defer to you.
Sure.
So, here's another one.
Okay.
I'm sorry. I don't mean to rush you. Just
No,
going through these questions.
Go ahead.
So here, and you touched on this already a little bit. So we have these terms, and we've talked about quarantines and isolation. What about the specific term stay-at-home mandate? Does that also qualify for paid sick leave if it's a, quote, stay-at-home mandate and not technically quarantine or, quote, isolation?
So I think Tabby and I are on the same page that we, again, absent guidance that says these shelter-in-place stay-at-home orders do not fall within number one, they do, because that's essentially what they're doing. They're telling people to self-quarantine at home and only go out for emergent reasons. We've got to go to the pharmacy, the grocery. They can't put us all in a bubble. So I'm not sure what else quarantine or isolation could mean. If the government has imposed restrictions on our ability to move, then at least, again, right now, I say that falls within number one. That's how I'm interpreting it.
And I would add that if you're an essential business and you feel pretty confident that you're an essential business, then you would kind of fall out of that isolation or quarantine.
Yes.
And so maybe
exactly. Yes. Yes. That's exactly what I've been telling businesses is if you are an essential business, then and you fall outside of that, and that goes back to what I said earlier, is you have to look at the order that is passed that's applicable to your city, your state. And again, if they are following the Homeland Security guidance issued on March 19th, then that has a whole listing of industries that would be considered essential and tethered to the essential businesses. So if you are an essential business, then those orders should not apply, and therefore you would not have a reason for leave under number one because your business is exempt.
Okay.
And that
one
actually
other thing
leads
that
Michelle to sorry, I got a question before the webinar from an employer who is an essential business in a place where there's a stay-at-home order, and one of the employees does not want to come into work, for fear of getting the virus. So Michelle and I were going back and forth on that. I think we both agreed, if you're an essential business, if there's no way that the person can telework, if you followed the CDC guidelines, the OSHA guidelines, this employer was also offering protective gear, and the employee won't come in to work, then I think you need to terminate the employee. Michelle?
Yep. Yeah, at some point, if people, if there's nothing preventing them from working and they're just scared, that's just not enough.
Michelle, I did have a question under the ADA. If someone has a chronic condition, pre-existing condition, particularly that could affect their breathing, I suppose it depends on what job function they were doing and whether there can be an accommodation. But I would think you might have to do an analysis at least if you have 15 or more employees and you're subject to the ADA.
Absolutely, and I've definitely done that over the past couple of weeks as we've watched this upend everybody. We have had to do ADA analysis with people who, but for this pandemic would maybe have not needed any kind of workplace accommodation for their disability. But now that this is a real, a threat in our communities, they might. And so you are not alleviated from your duty to engage in the interactive process with the person to determine if there is a reasonable accommodation. And certainly, you know, I have gone through people with reasonable accommodations where, okay, telework might be an opportunity as a reasonable accommodation during this time, or allowing people to, you know, work in a more isolated space where they're not coming into contact with other people, protective gear, if they have PTO or vacation or some, you know, some kind of leave available to them, you know, allowing them to take that period of leave for a couple weeks to see if you know, things sort of settle down and we, you know, are able to flatten the curve. I mean, again, it really, but it's the same analysis. If there's going to be, you know, a substantial undue hardship on your business, you may not be able to grant that accommodation, or you might not be able to grant the accommodation that the person wants. You know, for example, I work with some businesses where they have employees that work and live in the site. They have an apartment within the work site and they stay there, but they were concerned about other people who also live there potentially bringing in and exposing. And so we gave them the opportunity to work remotely from their residence and self-quarantine, or if they wanted to self-quarantine elsewhere, that was up to them. But then when they started saying, well, but we want you to pay to put us up in a hotel, yeah, no, we don't have to pay to put you up in a hotel because we provide a residence for you, and we're providing you the opportunity to quarantine within the residence and work remotely. But if that's not the accommodation you want, and you want to go work remotely from some other place, well, then that's going to be on your dime. So yes, you do still need to go through that interactive process to try and figure out if there is a reasonable accommodation that will not impose an undue hardship.
So for clarification, I know you talked about this. There are individuals who are just not reporting to work because they're afraid of catching COVID-19, and they're not. There was no exposure. They're not caring for someone. Is the employer still obligated to keep that person's position open if they just choose not to come to work?
No.
No. No. The other thing is, you know, this is FMLA leave, so technically they're supposed to request leave in order for you to give it. I've been talking to some of my clients. I mean, you need to put the notice up. This is all passed quickly. My clients who are going to go ahead and do the paid sick leave, I say let's do it for everybody who qualifies for it without making them all come and request it. But technically, you know, if someone's just not showing up, they haven't requested leave, they haven't you requested an accommodation, you don't have any obligation to protect their job.
So here's another question. On this slide, I've gone back to one of the first slides. On this last bullet point, it says leave could begin as of Friday, March 20th and must be given starting April 2nd. Can we dive into that April 2nd date? What does that mean that it must be given starting April 2nd?
And that's a little bit too simplified. April 2nd is the effective date. Yeah, sorry. April 2nd is the effective date for the laws, the 2-week sick, paid sick leave law and the 10-week parental leave law. That's the date they become effective. If someone comes to you and asks for it, you need to give it. And so that's kind of where that date comes from.
If they qualify for it. So right now, basically, the IRS is saying, hey, rather than putting people on the unemployment line, if you can go ahead and start doing the paid leave now, even though it's not effective until April 2nd, you can start getting the reimbursement for that. If they fall within one of these 6, groupings, or the emergency FMLA, which goes up to 10 additional weeks beyond these first 2 to care for a child who's out of school or out of daycare because of the public health crisis. But come April 2nd, if an employee needs leave, again, and you're subject to this law, an employee needs leave for one of these reasons, then you will be obligated to provide it. That's basically the distinction. Is once we get to April 2nd, we're in a period where we're obligated to provide it if one of these things are implicated.
Michelle, this is a hard question. Oh, sorry, Trent.
I'm sorry. I don't mean to rush you. They're just, the questions are still pouring in.
Well, here's a hard question I've been getting. This is a hard question I've been getting. Starting April 2nd, what if can we just terminate our employees rather than giving the leave? What I've been saying is you can terminate your employees because of business necessity, at any time. I would document the business necessity. You cannot terminate just because you don't want to give this benefit. And it may be, if you are pretty sure you're going to terminate employees, go ahead and do it before April 2nd. And definitely, I would not terminate an employee who has requested the leave starting April 2nd and beyond, because there's a pretty protective for employees anti-retaliation provision in the law. Michelle, your thoughts?
Mm-hmm. Yeah, no, yeah, definitely. If you already know that you've got to tighten up the belts, like as we sit here today, that business as it stands today is not sustainable past the end of the month, then those are decisions that you need to be thinking through right now, because people that you carry forward into April, then if one of these triggers pops, then you could have an obligation to put them on a paid leave with some level of job protection. Now, that's not to say that people go out on FMLA and things change. There are provisions within the FMLA that if the needs of the business change while the person is out on a leave of absence protected by FMLA, wherein upon completion of the leave they would normally be reinstated to the same or similar position. But there are provisions when there are reductions in force, and that person would have been wrapped up in that reduction in force had they been there at the time and not on FMLA. But I would say when you start getting into those real nuanced situations about getting rid of people after April who are triggered under these laws and are taking leave under these laws, that you work with your counsel to make sure that everything's real clear. But if you have people right now that they're kind of sitting in limbo, they're out of paid leave, you're not going to go ahead and start the paid leave early, that your business cannot sustain all these employees, now is the time to be making decisions about what you're going to be able to do.
The other thing I'd add, Michelle, sorry, Trent. One thing, and then I'm going to let Trent talk, I promise, is, starting April 2nd, you need to put a notice about the paid leave law. And there's going to be a model notice, hopefully by tomorrow, from the agencies that you're supposed to put that in a conspicuous place. So presumably your employees will know about it. Sorry, Trent.
If an employer is already, so we're talking about this April 2nd deadline. So if an employer is already laid off employees, temporarily laid off employees, or furloughed employees, they won't have to offer this emergency FMLA or sick leave as long as it's before April 2nd?
Right. If they already laid people off, then they're no longer employees.
Right.
Right.
So yeah. So there are
the question.
Yeah.
The question came in, and I'm not sure exactly what this means, but it says temporarily laid off or furloughed.
Okay. So in the private sector, there is no furlough law. Furlough is really you see that in the public sector a lot, but in the private sector, I can tell you because I just went through all the 50 state research, there are no private sector laws on furloughs. Really, what a furlough, when we talk about furlough in the private sector, it's a fancy way of saying layoff subject to recall. Or we have cut somebody's hours, but we're allowing them to maybe burn through any accrued paid leave they have. So they're still on our payroll at the moment because they're drawing down any paid leave they might have. But as soon as they're out of paid leave and you're not paying them to work, they're eligible for unemployment benefits. And that's a layoff. even if they're subject to, even if the hope is that we'll recall them and put them back to work, they're still laid off. Now, the only thing that will make a difference as far as unemployment is concerned is whether we believe this is a temporary layoff or a permanent layoff. If it's a temporary layoff, then most states will exempt them from the work search requirement that goes hand in hand with getting weekly unemployment benefits, versus if it's a permanent layoff, then they will likely make them start the job search requirements, although many states are saying that because of the massive amounts of people that got dumped into the unemployment system in the last, week to 10 days, that they are suspending the job search requirement for a period of time because the jobs clearly are not plentiful at the moment. But really, if someone is no longer working for you and getting paid and they have no paid leave, then they're laid off.
Okay. The next question is coming from an employer in Massachusetts. They say that they are an essential business and they are still open. But if they have an employee that presents with symptoms but not a definitive diagnosis, can they force them to stay at home for 2 weeks? And if they did, how would they be obligated to compensate them?
So yes, if someone presents with symptoms, then they need to go home. And so I think that could fall within our number 3. Potentially we've sent them home, because they're experiencing symptoms, and I would say they probably are going to seek medical attention for those. But I think you would probably have an obligation to pay them if you send them home because they have the symptoms, and that would be emergency paid sick leave, unless this is someone who could work remotely and therefore, they're just at home, quarantining at home and working remotely.
Okay. That makes sense. What about an employer that is an essential business, but they're not sure how that's defined in multiple states, so they have employees in multiple states? So should they just look at state guidelines for what is and is not an essential business?
So that goes back to what I was saying earlier. Yes, I think you start with the orders that are applicable where your businesses are. And again, many of them are deferring to the Homeland Security guidance. And so you may ultimately determine that you're able to go to one spot. The other thing is some of these orders are also providing a mechanism to challenge whether you are or are not an essential business. And like I said earlier, we have a link on our homepage for the essential business team. And so we are maintaining updates there as well. But that might be something that you're going to, need to drill down with, and maybe even with the advice of counsel.
There's some questions coming in regarding number 6 on this slide of who qualifies for paid sick leave. So number 1, some attendees are requesting clarification for number 6, where it says substantially similar conditions as will be outlined by HHS. And another question pertaining to this is, do employees in high-risk categories due to underlying health conditions or age qualify under number 6?
So we haven't heard anything about number 6. I think this is a placeholder right now until HHS can get their arms around, what type of standards they want to use. But I would say definitely if they have employees with pre-existing conditions that could make them particularly vulnerable, then you could presume they were advised by a healthcare provider to self-quarantine. They could call the COVID hotline for the state and get that advice, I'm sure. Or they could, if you would like a note from their doctor, you can request that, based on the medical substantiation guidelines under the FMLA. Trent, I'm wondering if we should go to the benefit slide just so that we cover medical plans before, as we continue to field questions, so that people have that kind of on their mind as well.
Yeah, bear with me.
Sure, I think it's the second to last slide.
Okay.
Yeah, ACA considerations. Yeah.
There we go. There we go.
So we're going to be sending out the slides. Trent will send out the slides, so you'll have all this information about kind of the concrete information we have of the types of leave. But something that I've been feeling a lot of questions about is, what do we do with our medical plan? What do we do with our fringe benefits? So when thinking about employee eligibility in light of layoffs, if you terminate someone, and so they are technically terminated from employment, even if they're subject to recall, generally they're also going to lose their health plan coverage. That's almost a universal rule that benefits attorneys will tell you. However, what I'm seeing from large carriers is that they are extending coverage even for employees who have been laid off and terminated, if they were full-time, if they were participants before the layoff. And of course, this is layoffs that are caused by the COVID-19 crisis. So I know Humana and that they will continue coverage for employees who are laid off because of this emergency through the end of this month, March, which is not a huge statement because most employer plans, even if you're terminated mid-month, you're going to continue to have coverage through the end of the month. So it's not a huge statement, but the fact that they are doing this and considering this means that they might do the same in April. So that's something to think about and just kind of keep your ear to the ground on. I've also had success working with Blue Cross for clients and them extending eligibility for full-time employees who are no longer working full-time hours, just because of this crisis. Something to think about: if you are subject to the ACA's employer mandate to offer coverage, health plan coverage to your employees, and you're using the look back method to count hours. So you look back at last year, see how many hours someone worked, and then that person is in a stability period for the plan year where they're either full-time or part-time and their status doesn't change during that year, not be able to drop coverage for employees who are full-time and in a stability period. So you want to be thinking about that. Another thing is, under the Affordable Care Act, there are rules about how you treat rehires if you're subject to the employer mandate, which of course is 50 employees or more. So if someone is terminated and rehired within 13 weeks or 26 weeks if you're an educational institution, then you need to offer them coverage. Pretty much, if they were participating in coverage, you need to go ahead and get them back onto the plan if that is their election as soon as possible. Just treat them as if they never left. So the idea is, in this context, you don't treat them as a rehire, you treat them as a continuing employee. And particularly if they're in a stability period and they're considered full-time, they should get back on the plan as soon as possible if that is their wish. There's a rule of parity, which may or may not come into effect here. What it says is, if you've only had someone in your employ for, say, 4 weeks, then if they're terminated and rehired within 5 weeks or more, you can treat them as a new employee and make them go through a waiting period and things like that, just like you would any employee. But the rule of parity basically means if someone's worked for you fewer than 13 weeks, you don't have to extend this 13-week grace period during a layoff to that person. That the grace period really just has to match the amount of time they were with you before the termination. Something to think about is that if your employees are on leave, but they're still on, technically your employee, you haven't terminated them, that leave might be protected by the FMLA, particularly this new FMLA. And in that case, their benefits are also protected. So you still need to offer them benefits, at the same level and with the same amount of subsidy as you did before the leave. Something to know about the emergency sick leave law is that it will reimburse you not only for the paid leave, but it'll also reimburse you for the employer portion of a medical plan that you're subsidizing for your employees, which is good to know. If your benefits are going to change, I've been working with employers whose benefits are going to change. Be aware that there are notice requirements under both the Affordable Care Act and ERISA that you might need to be paying attention to. COBRA is going to be a going concern, but the difficult thing is if no one is actively at work anymore, then you don't have an employer-sponsored plan anymore. And so there's no COBRA. The other thing to think about is if you terminate part of your plan so if you terminate your whole plan, there's no plan for anyone to have continuation coverage for, and that's not a qualifying event under COBRA. If you terminate your plan for, let's say, a certain division or let's say a location that's in, really hard hit area, that's also not a qualifying event. If you were to also terminate employment for the people working in that location, that would be a qualifying event. Let's see, so extending coverage for full-time employees, that's just talking about the carriers are doing that. And I've had employers request from either their carriers if they're fully insured or their stop-loss carriers if they're self-insured to extend coverage while people have fewer hours and are not working full-time. And the carriers and the stop-loss carriers have agreed about it. What I always talk to my clients about is, get that extension in writing, because if someone is on your plan and they did not work full-time hours in a month, and based on the plan document and how you've been running your plan, that means they should not have been eligible for the plan, and then they rack up a bunch of expenses, the carrier or the stop-loss carrier can deny coverage for those medical expenses, and then they can turn around and sue you for it. So you want to be really careful if you do extend the plan to people who are no longer working full-time hours, that the carrier has either published something like Anthem and Humana, or that you have in writing from your carrier that they approve of that extension. So that's just things to think about with respect to your employee benefits as you're navigating the pandemic.
All right, so that takes us to employer questions. I think we have some laid out here already. Out of Michelle or Tabby, I'm not sure which one of you want to take this. I know some of these we've touched on already, but some of these we have not.
So we touched on what if someone comes to work sick. If somebody tests positive, which we are having this happen a lot now, so we need to be looking at who they worked with, when do they start experiencing symptoms, when were they tested, when did they get the results. It's quite possible that you will have to, while this person is quarantining because they have tested positive, it's quite possible that you will have to quarantine the folks that worked in close contact with them over the past several days. I know that it's not a hard and fast, rule on how far to look back. And so I basically have been advising people when this comes up, let's have a discussion and let's see what makes sense. The fact that the person just walked into the building, do we need to shut it down? No. But if the person was there and working very closely in confined spaces with someone when they are quite more than likely were contagious, well, then that's going to be a different answer. I had one recently where they were sharing vehicles. They drive trucks, and there's different truck drivers, times of the day kind of thing. And so anyone who had used that truck in a period of time, we quarantined. So, but I will tell you, it's quite possible that you will be quarantining a portion of your workers if you've got an employee that tests positive. Can I take temperatures? The EEOC has come out with guidance normally. That could be considered some kind of medical exam, but there is within the ADA, there is an exception when it's related to a legitimate business necessity. The EEOC again has come out with guidance that you can take temperatures. Certainly, we recommend that you do that in a safe way where, certainly if someone has a temp, that they're not walking all the way through and chatting in the break room and this, that, and the other thing before they get their temperature taken. It's not being done out in some public view where everybody can see. It's again done in a private space. With the safe practice. You shouldn't be writing down people's temperatures and keeping records of all of that. But you know, the simple answer is yes. There is an exception within the ADA that for this pandemic reason would allow us to take temperatures.
Great. And then I was going to jump in on, am I required to continue benefits for employees on leave? And I answered that to some extent.
Mm-hmm.
You know, if they are still your employee, and they are on FMLA, then their benefits are protected, and they need to continue until
Mm-hmm.
that FMLA leave has run out. If not, this is a great time to brush up on COBRA and understand, you know, when COBRA will apply and when it won't. And so, you know, certain events like I was talking about, a planned termination is not going to be a qualifying event for COBRA, but employee termination is. And then you want to be thinking about which of your benefits is subject to COBRA. So usually a health reimbursement arrangement is, unless it's a QSARA or a qualified small employer, HRA. An FSA, a flexible spending account, is for health reasons, is going to be subject to COBRA if the employee has not spent on a pro rata basis all of their benefits yet. And you only have to offer that for the rest of the year. So you just want to be thinking about the benefits you offer and whether you're going to have continuation obligations. The other thing
oh, sorry, go ahead.
Their employees connect with a navigator to find exchange coverage.
So the next one, exposure, is that possibly a workers' compensation claim? Generally, most policies that I have found are not going to cover it unless there is a direct link to them becoming exposed in the workplace. So if you have people who are at high risk to contract the virus because of the nature of the work, so you know, obviously healthcare providers, if they could, I guess, connect the dots that the person contracted it, and it's a workplace related illness, then possibly. But as with all insurance policies, my default guidance is I am not an insurance broker and I don't write policies. So you should always ask the questions to your insurance broker expressly about your policies and what it includes and what it doesn't include. And I always say that, you know, the worst thing that can happen is they say no. The best thing that can happen is they say yes. But in the carriers that I've spoken to, most of them are saying, look, if the person just, you know, gets sick and we can't relate it back to the workplace, then they're not covering it. I think we've answered the one about, is it, you know, working remotely a reasonable accommodation under the ADA? It certainly could be, again, subject to the interactive process and whether that imposes an undue hardship on your business. But it certainly could be, and was even before we found ourselves in the situation that we see ourselves in today with the pandemic. Can we implement furloughs and layoffs? I think we've pretty well gone through that. I think we've kind of gone through the last one as well. So maybe if there's any more specific questions we didn't answer, be the time to do that.
Yeah, so there's one more question, Tabby, on the benefits side. This is just a very specific question, and then I'll close things up after this one and talk about how we'll get to the remainder of the questions. We do have many more questions that we will respond to. We'll respond to those via email. What I'll do is I'll make sure and go through everyone who asked a question and make sure that you have a response. So if you have any questions and you're still on the line, then go ahead and submit those. That way we can get back to you. But we don't want to make this webinar last any more than about an hour and 5 minutes. But a benefit-specific question for you, Tabby. Have you heard of any guidance on whether or not a self-funded MEC plan will cover the COVID-19 testing? The new law seems that they compel coverage for this, but we're not sure.
Mm-hmm. Right, and this is definitely kind of more of an insurance question, than a benefits question. But my understanding, and at least, what I've seen from the large carriers, so this isn't necessarily a MEC provider, but, obviously they're saying they're going to cover the testing, and that is part of the law. And I have to assume it applies to MEC plans as well. I don't know what would exempt them because they're still, so they are self-insured. So that is a bit of a wrinkle. But from my understanding, even self-insured plans are doing this. My best answer, kind of along the lines of Michelle's workers' comp answer, is get in touch with your broker and or the carrier for the MEC plan, and ask them that question. I haven't looked at the specific question of whether the law that requires plans to cover the COVID-19 testing would require self-funded plans to do the same, although because it's a federal law, I assume that it would.
Okay. Well, that pretty much sums it up for us. Again, if you submitted a question and we didn't address your question, I'll make sure that we get back in touch with you via email. There will be a follow-up email from me that has this recording actually attached to it. You can respond to that with questions. Michelle, thank you so much for your time. Tabitha, thank you. Wonderful as always. Is there anything else that you would like to say to close it out?
No, thank you for your time, and thank you.
Yeah.
Thank you, Michelle,
Yeah, thank you
for joining us.